access to other face coverings and masks, like surgical masks, that's fine. We just want to make sure that you're using something and requiring every single one of your employees to have these face coverings, because they're protecting the consumers that come into contact with your business. Effective May 11th, every business that is identified as an essential business in the current public health order, that order is in effect until May 15th, operating as a retail space shall require employees to wear face coverings, cloth masks, surgical or procedural masks. We know unequivocally that this will help us protect those consumers. In solidarity and making sure you're doing your part, I highly recommend that you wear face coverings for all of your essential travel to a business. Next slide, please. All right, so why are we doing all of that? Well, the number one reason, even though this slide says phase one, the number one reason is to protect each other, to control, slow the transmission, to mitigate the effects of this virus. But if we're aiming for a phase one, remember from last week we talked about our guidelines and our efforts to relax restrictions, to methodically and safely, prudently and productively to open up New Mexico for business. Well then, we have to show that we have this infection managed to the highest degree possible. So in aiming for phase one, which is mid-May, we make that decision based on the data. The data will tell us whether or not, because we're testing every day, we're seeing who's in the hospital every day, we're tracking every single tragedy every single day, then we're going to know unequivocally whether enough people are socially distancing and are following these CDC best practice guidelines. So before we can move forward, I have to see unequivocally by the data that the spread of the virus, in fact, is continuing to be mitigated. So, your decision, every single New Mexican, every single business that works diligently to meet both the requirements, and if you're not included in that May 6th, May 11th requirement, lead by example. These personal decisions unequivocally determine whether it will be safe for us to move forward in mid-May. Next slide, please. Okay, I have some nice and good and positive, productive and fair, long time in coming. So we finally are getting access to our federal stimulus money. And I wanted to announce again that we are going to be providing early childhood. This is really early childhood care, child care center worker hazard pay. And remember early on, we required that a number of employees and employers maintain business practices. Well, having access to child care for healthcare workers and first responders and other workers in the essential workforce workspace have to have access to child care. And so all of these child care workers and all of these child care providers statewide since March have been staying the course and have been serving safely and productively in a compassionate and lovingly way all of these children, all of these families. So our brand new department, our Early Childhood Education and Care Department, that's what the ECECD stands for, they're going to use a portion of their federal CARES, that's the number of the act that was signed into law that provides now stimulus funding to states. They're going to offer incentive pay to early childhood professionals working in centers that remain open during this pandemic. So I want to point you to is $700 a month in addition to their current wages and salaries. It's an incentive for full-time workers and $350 a month wage for part-time workers, so exactly half of that $700 a month incentive. We're also going to provide $12 million in grants for licensed child care providers who have been unequivocally harmed by this health emergency. Now, I do want to say, and frankly, it needs to be said more often, some of the lowest paid professionals in any careers in the state are in early childhood and in child care work. these incentives or hazard pay efforts are really important, and I wish it was more. And every New Mexican needs to think of a way that you can thank these incredible workers and the sacrifices their entire families are making to make sure that critical services continue, and quite frankly, to make sure that our healthcare workers have the support that they need to support and protect and provide the necessary life-saving healthcare services that you need. So a huge shout out to all those child care centers and all those child care workers. We're grateful, and I'm very pleased to announce this, people should expect this to happen as quickly as we can get this money out the door. Next slide, please. All right, I am going to do this. I don't know that this slide is actually mine, so I'm going to leave it up there. And we're going to go, I'm going to call on General Nava. He's taking off his mask. Go ahead and do that, General. But I just want to also thank the men and women who serve this country without delay, never asking questions, and being very clear that they have a responsibility to make sure that all of the efforts we undertake to keep people safe, fed, and access to water is occurring. They're also ensuring that we are getting our test samples couriered to laboratories. They're cleaning nursing homes. He's going to talk to you specifically about much of this, but it's a great place for me to thank the men and women, General, and their families, and to also thank you personally for your leadership and your work. General.
Thank you very much, Governor. Before I start, I would also like to extend that thank you to the families and employers of the over 600 New Mexico National Guardsmen and women that are here. We can't do what we do without our families and without our employers, and they've been incredibly supportive of us. And so I'd like to thank them as well. We have over 600 New Mexico National Guards men and women who are on duty and who are doing great work throughout the state. They've driven over 140,000 miles, delivering over 4.3 million pieces of personal protective equipment throughout the state of New Mexico. They have also delivered countless pounds of food and bottled water, tanked water, and individual meals throughout the state of New Mexico. New Mexico National Guard is also very involved with the Department of Health in doing medical screening, helping with the testing sites, assisting with long-term care facilities. They're very, very active in doing everything that we can possibly to help our fellow New Mexicans. I think we all should be very, very proud of what the New Mexico National Guard is doing, and thank you, Governor, for the opportunities that you've given us to do this and help our fellow New Mexicans. I believe we have some pictures. They may be coming there. So we have some photographs. Here's some of your New Mexico National Guardsmen and women delivering personal protective equipment. I believe this was at Laguna. Again, we have distributed over 4 million pieces of personal protective equipment. We've delivered tanked water all over the state, and one of the things that we want to do is make sure that our fellow New Mexicans are safe. So what you see right here is one of your New Mexico National Guardsmen testing the water to make sure that it is appropriate for potable water consumption. And there's one of our National Guard folks helping out at a test site, giving the thumbs up again for the great work and collaboration that we're having with the Department of Health. Again, ma'am, thank you for the opportunity that you've given us to help our fellow New Mexicans, and we look forward to continuing to help as we all get through this together.
Got it. All right. We're going to go next to the Secretary of Health, and I know that we're moving the camera a little bit slowly, so that's complicated. Before you go to the Secretary of, right here. Well, I know. So thank you. Sorry about that. Those photos do not do justice to the amount of work that the National Guard is providing. They are quite literally nearly in every single community. And when you hear from the Secretary of Health by the multiple efforts and sites and communities that we're in, and that it's not just delivering food in places that really need it, that don't have ready access to food and water like so many of our sovereign nations. These are also food deliveries to seniors and to children, making sure that since school's been closed, that not a single family who was expecting those meals for their children to be delivered and prepared at school, that's happening with the support of the National Guard. And any of our state police activities that require setup and related support, not police support, but just the rest of it, that's your National Guard men and women, and they also manage our Emergency Operations Command Center. So it's an incredibly comprehensive effort. I don't know how they do it all with just 600 men and women, and I want to make sure that New Mexicans know that, frankly, those photos are great, but they don't do justice to the amount of work that you're doing every single day, and they're on call and delivering much-needed services 24 hours a day. 7 days a week. And without them, there is no way we could manage this pandemic. So again, thank you to those men and women and the families and the employers. Okay, I'll try to do a better job so I give better cues. Now we can go to the Secretary of Health. That's my fault. Now to the Secretary of Health.
Thank you, Governor, and I would echo that about the National Guard. They are standing up test sites for us in high-risk areas. I'm deeply appreciative of that, of the many, many things they did. And there's also a National Guardsman on our testing team who has been an exceptional aid to us. And as the Governor said, we have performed over 83,000 tests to date. We have the capacity to do 5,000, and I'll be talking a little bit more about this. But we need the efforts of both the state and our private and public partners to reach that capacity. As you know, we've been focusing on long-term care centers, on congregate sites, essential workers, grocery stores, child care workers, but everyone can get tested. And if you are an individual and you want to be tested and you don't know how, you can call your local public health office and they will schedule a test for you. Or you can call our 1-855-600-3454 line and make a request that will be delivered back to the Department of Health. If you're a business or a municipality and you want to be tested, call the public health office and ask to be placed on our calendar. We do have a calendar of testing, so we plan ahead, but we will work you in, particularly based on the urgency of your need.